Hello, my name is Colleen Hernandez, calling in regards to the Providers Health Alliance Open Enrollment. The benefits that we're going to be reviewing today are for the November 1st, 2020 through October 31st, 2021 plan year. I'm happy to announce that in addition to renewing your current benefits, we have a variety of new benefits being offered to all employees. As a reminder, though, the benefits that you elect right now will remain in effect the entire plan year. It can only be changed if you have a qualifying event. Please note that a qualifying event will allow you to change your dependents and not the plan that you elect. So it is very important that you do choose the plan that's going to be most appropriate for you. Qualifying events are going to include marriage, divorce, involuntary loss of other coverage, if your spouse is in open enrollment. And again, as a reminder, those qualifying events, those life-changing events, will only allow you to change your dependents, who you cover, and not the plan that you are currently enrolled on. We're going to be reviewing the benefits at a glance up on my screen. You can take a peek at the bottom of page 1. This is a little refresher on how you're able to locate participating medical and dental providers. Also down at the bottom, you'll find a little note, medical plan. You're allowed to keep dependents covered until age 30. Dental and vision, you can keep dependents covered up until age 26. Take a deeper dive at your current 3 medical plan options. As a reminder, these 3 medical plans are the same exact plans that you have offered to you right now. Plans in columns number 1 and 2, the Florida Blue Care HSA compatible 16452 and the Florida Blue Options HSA compatible 16202 are both, as it says, HSA compatible plans, which means that you are going to be responsible 100% for all care and treatment until you satisfy your deductible. After you satisfy your deductible, then you'll have some cost share until you reach your out-of-pocket maximum. These plans, the deductible is $3,250 for an individual, not to exceed $6,500 for individuals with family coverage. Once you satisfy your deductible, you then be responsible for 10% of the medical expense until you reach your out-of-pocket maximum, which on this plan is $6,550 for an individual or $13,100 for a family. Any deductible or out-of-pocket expenses that you have already accumulated in the 2020 calendar year will remain with you until January 1st, 2021, and then it will restart. Difference between these 2 plans are going to be the network. You have the first plan is the Blue Care Network, and the plan in column number 2 is the Blue Options Network. The Blue Care Network is an HMO-based plan where you must pick a primary care provider. However, you do not need a referral to see a specialist. On this plan, though, there is only emergency-only coverage outside of the network. The Blue Options HSA compatible plan does have out-of-network coverage. However, you will notice a significant increase in your financial responsibility if you choose to go out of network on that plan. Scroll down a little bit further, I did want to talk about the prescription drugs. After you have satisfied the deductible, then you'll have a $10 generic, a $30 preferred brand, or a $50 non-preferred brand copay, or $150 copay after the deductible for specialty drugs. Again, this is after you satisfy your deductible. These 2 plans, if you have dependents, you as an individual or collectively as a whole must first satisfy that family deductible before you have any coinsurance and those prescription drug copays kicking in. The last plan we're going to talk about is the Blue Options 14104. This plan does work differently than the other two plans in the sense that, number one, there are copays that will kick in prior to any deductible satisfaction for a lot of the commonly utilized services, including a primary office visit or a specialist visit, urgent care, any lab work done. You're responsible for that straight copay right away. Services such as emergency room, x-rays, MRIs, CAT scans, PET scans, or hospital stays, both inpatient or outpatient surgery, you are responsible for 20% after you satisfy your deductible. Deductible on this plan is $1,500 for an individual, not to exceed $3,000 as a family. Your out-of-pocket maximum is $5,000 for an individual, not to exceed $10,000 for a family. This plan, unlike the other two plans, one individual within the family unit will never be responsible for more than the individual deductible or the individual out-of-pocket maximum. The other two plans, it does not work that way. On the first two plans, the HSA, collectively as a family unit, you must satisfy your deductible or your out-of-pocket before you have any cost share. On this last copay plan, again, if you have dependents covered, if I, being the dependent of the enrolled employee, satisfies my $5,000 out-of-pocket maximum, the rest of my care and treatment is free until the deductible resets itself come January 1st. This plan does have out-of-network benefits available to you, but again, you will pay substantially more if you choose to go out of the network. Prescription drugs, $10 copay for generic, $30 for preferred brand, $50 for non-preferred brand, and your specialty is $150. These are straight copays, so you'll instantly be responsible for the applicable copay immediately on day one of your plan. Jumping over to page 3, it's just a little recap of some ways that can help you save some money on prescription drugs. Those of you who elect to enroll in the HSA will definitely find this useful since you are responsible for 100% the cost of the medication until you satisfy your deductible. Both Walmart and Winn-Dixie, they have $4 for a 30-day supply of a generic medication or a $10 copay for a 90-day supply of generic medication. Publix offers free antibiotics and some routine maintenance medication for free as well. In addition, GoodRx, which I know a lot of people are becoming more familiar with, is a website where you're able to type in the name of your medication and your zip code, and it'll tell you pharmacies within your area that carry the medication. And if there is a coupon, a manufacturer's coupon, there'll be a link right there on the site where you're able to download the coupon and start saving some money. All of these programs that we just reviewed, they're actually, doesn't matter if you have insurance or not. And all you need is a prescription in order to start taking advantage of them. Page number 4 is going to talk about a Florida Blue Clinicunista. What these are Florida Blue owned medical centers. Each of the centers could have different things. One clinicunista may have an urgent care, one of them may have advanced imaging. So to learn more about where the closest clinicunista is, as well as what services they offer at that clinicunista, you would visit www.mysunistas.com/FL. There's information on Employee Navigator, which I will show you shortly. The Florida Blue Clinicunista, since they are owned by Blue Cross Blue Shield, are going to help you save a lot of money. You can get a doctor's visit for as low as $5 on the plan, so it's definitely going to be something that will help save a lot of money. The next thing I wanted to mention was the Teledoc benefit. This benefit allows 24/7 access to licensed medical doctors. Teladoc is great for a variety of things. If you look at page 6, it talks about Teladoc's top 25 diagnoses within the state of Florida, including upper respiratory infection, sinusitis, bronchitis, a variety of different things. Great if you have a rash, not feeling very well. Maybe you wanted an opinion on something before you ran out to a doctor. Currently, through October, the cost through October 2020, the cost to use Teladoc has been waived. However, when your plan renews on November 1st, the cost to use Teladoc will be reinstated. So just please keep that in mind, that if you utilized Teladoc as opposed to going to a doctor, you are definitely going to save some money. But if you use it after November 1st, there will be some kind of employee responsibility, which again will go towards your deductible and out of pocket. But currently it is being waived, so it is not always free. It was just being waived due to the pandemic right now. Page 7, dental benefits. Your dental benefits are offered to you through Guardian. You have a choice of 2 different dental plans. The first plan we're going to talk about is the DHMO plan. On this plan, you must pick a dentist. You see that dentist. You have to see the dentist that you're assigned to, or you will not have coverage. The second plan that you have to choose from is the PPO dental plan. You'll have a larger choice of in-network dentists, and you also have the option to go out of the network if you do so choose. On the DHMO plan, there is a copay for every single covered service. So whatever you have to have done, as long as it's covered, you're only going to pay a copay. There is an unlimited benefit, so you can go in as many times as you want. Every single time, as long as you're having something covered, you will have a copay. On this plan, it also pays for both child and adult orthodontia. The PPO plan, you're given $1,000 calendar year maximum. And then in addition, you're going to have co-insurance. You're going to have cost sharing. So DHMO, you have copays. PPO, you guys share in the expense. On the PPO plan, you have a $50 individual deductible within the network, not to exceed $150 collectively as your family unit. In network, all preventative care and treatment, no cost to you. Basic services, which are going to include fillings, root canals, and periodontal scaling and root planting, like your deep cleanings, you're responsible for 20% after the deductible, and any major services, you're responsible for 50% after the deductible. The PPO dental plan does have orthodontia. You're responsible for 50% with a $1,000 lifetime maximum, but it is only for children up until the age of 19. As I mentioned earlier, you do have the option of going out of network. You will be responsible for more co-insurance as well as a higher deductible. However, you do have the choice of doing so. I did mention earlier that everybody has a $1,000 calendar year benefit, so that benefit replenishes itself every single January. However, now because you have been with Guardian on this plan, it is possible that some individuals may have more than a $1,000 benefit available to them. If you have gone to the dentist and had something done and Guardian has paid out less than $500 for you during that calendar year, they're going to reward you by giving you anywhere from $250 to $350 if you remained within the network only to use towards future years' benefit bucket. So that is an individual basis, but every single covered member, they're each given $1,000 at the minimum. Everybody enrolled in the dental program is going to receive the college tuition benefit. This is a benefit absolutely free to those enrolled on the dental plan that will help you save for your qualified dependents' college education. Qualified dependents are going to include children, stepchildren, grandchildren, nieces, nephews, godchildren. So essentially, as long as you're able to obtain a child's name, date of birth, and address, you're able to register them as your qualified dependent. You must register on the website, though, to start taking advantage of those points. You must be registered within 6 months of the effective date of the plan in order to receive the points for that plan year. If you have not already done so and have currently been enrolled on the dental plan, please do not wait. Let's take advantage of this program. You may not have a qualified beneficiary right now, but you could in the future, and that money will just start accumulating for them. Next, we're going to talk about the vision plan. Vision is through Guardian, the exact same vision plan you have right now. It utilizes the VSP network of providers. You have an eye exam every single year. You have the ability to get lenses for your frames or contact lenses every single year and new frames every other year. When you go to an in-network provider for an eye exam, you have a $10 copay. If during that eye exam they came to the conclusion that you need glasses, you have a $25 copay for the lenses for your frames, and then you're given a $130 allowance to use towards the purchase of the frames. If the frames that you choose cost more than $130, then you will receive 20% off the balance above the allowance. If you choose to get contact lenses instead of glasses, you're given a $130 allowance towards the purchase of the contact lenses. You can only choose one contact lenses or frames and receive that allowance every single calendar year. Here come some of the new benefits that we're going to be talking about. Every single employee, both full-time and part-time, will have the ability to take advantage of the Employee Assistance Program. This is a program provided through Guardian, which is going to provide employees with unlimited telephonic and online support. Helps with a variety of different things, including financial questions. They help you build a budget, budget to save for a big trip, retirement, will prep. They can answer some simple legal questions, some simple tax questions. They have information on exercising and eating healthy and stress management, a whole variety of different things. Again, unlimited online and over the phone support. In addition to online and telephonic support, they also provide 3 free face-to-face sessions with a licensed counselor at no charge to you. This is great. I know a couple of years ago when my daughter had first entered middle school, it was a rude awakening. You know, things are very different going from elementary school to middle school. Girls can be mean. I was able to take advantage, and my daughter was able to speak to somebody free of charge the first 3 visits. Also, right now, especially, things are very stressful. Pandemic, we have a lot of people losing their lives due to this. There's help out there. There's somebody to talk to. Sometimes it's just nice to have an outside ear to bounce things off of. Please, the service is confidential. Your employer, myself, nobody's going to know who called, what you called about, or anything at all. So help is out there if you need it. Next benefit we're talking about is the brand new life insurance. Each and every single full-time employee is going to receive a $20,000 life insurance benefit and a matching $20,000 accidental death and dismemberment benefit. Just when enrolling, please be sure that you elect your beneficiary. If, God forbid, you were to pass away, we know where you would like your money to go. Almost done, guys. Page number 9. If you feel that $20,000 worth of life insurance is not sufficient enough for your family, you do have the option of purchasing additional life insurance. You can purchase life insurance for yourself, your spouse, and or your dependent children. You can purchase life insurance for yourself in $10,000 increments up to $250,000. Guarantee issue is going to be $50,000. If you elect anything more than $50,000, you're going to need to complete a couple questions called an evidence of insurability form prior to them approving the additional amount. So everybody gets the first $50,000, no questions asked. Only if you purchase life insurance for yourself, you can purchase life insurance for your spouse. You're able to purchase life insurance in $5,000 increments not to exceed $125,000 for your spouse. You can only choose half of the amount you choose for yourself for your spouse. If you enroll in life insurance, you also have the ability to purchase life insurance for your dependent children. It is a $10,000 benefit, one child, 27 kids, all going to cost the same. If you do not enroll in the voluntary life insurance right now during this 2020 open enrollment, you may do so at a later point in time. However, you will be subject to the evidence of insurability in the future, regardless of the dollar amount that you elect. So if I was eligible to enroll in the life insurance and I decided not to, next year rolls around, I can choose only a $10,000 benefit. I would still have to answer questions though. Definitely something you may want to consider, being that the life insurance is offered to many, many people as opposed to one individual person, like an individual life insurance policy. Many people find the rates to be very affordable. So definitely play around, look at the volume and the cost, and decide if that is something that you would like to do. Another new benefit that we're going to talk about is the critical illness benefit. Critical illness benefit is offered through Guardian. It is going to pay you a lump sum in the event that you are diagnosed with a serious medical condition and or cancer. Medical conditions are going to include heart attack, stroke, organ failure, kidney failure, and or cancer. You're going to receive a $10,000 lump sum for yourself. If you elect to cover your spouse will get a $5,000 benefit. And if you elect to cover your children, they would get a $2,500 benefit. Children are covered on this benefit at no cost. So if you enroll in this plan and you have a child under the age of 26, please make sure to enroll your children. It does not cost you a single red cent more. Absolutely free to cover your children on this benefit. You just need to tell us about them. Otherwise, we're not going to know that they exist. Next benefit that we're going to talk about is the health savings account. This health savings account is only available if you enroll in either of the two HSA compatible medical plans, the Blue Care HMO 16452 or the Blue Options POS 16202 medical plan. The HSA health savings account will allow you to save money for qualified medical treatment tax-free. You're able to hold the money from your paycheck. It will go into a separate bank account that you're able to use for qualified medical expenses. Qualified medical expenses not only include medical, but includes dental and vision expenses as well. The money that you put into an HSA account is your money. It will stay with you forever and grow and grow and grow. You can use it for your yourself, or you can use it for a dependent that may not be covered on your medical plan, but they're still your taxable dependent. You do still have the ability to use it for that individual as well. If you were to leave the employer, that money is still yours and you retain the money. There are a couple things you need to keep in mind. There are annual limits. 2020, it's $3,550 if you enroll with individual coverage, or $7,100 if you enroll with dependent coverage. The 2021 calendar year, it's $3,600 for an individual, or $7,200 for family coverage. Anyone over the age of 55 can also contribute an additional $1,000 per calendar year. How much will my benefits cost? Page number 10 will review all of your biweekly payroll deductions, with the exception of the voluntary life insurance or the critical illness, because those two benefits are going to depend upon, number one, the dollar amount that you elect, and or your age. Open enrollment begins right now and is going to last until October 5th at 5 p.m. So please do not delay enrollment. This year we're going to be enrolling on the Employee Navigator website. Page number 11 is going to review how you can enroll in your benefits. So you're going to visit www.employeenavigator.com. You're going to click Login, and then you are going to register as a new user. Enter your first name, your last name, your company identifier, which is PHA space LLC, all caps. This is case sensitive. And then the PIN is the last 4 digits of your social security number. And then your birthday is the 2 digits for the month, 2 digits for the date, 4 digits for the year format. Once you register, you're going to need to choose your user ID, which we suggest using your work email address, and password. Password needs to be letters, numbers, and a special character. Once you are logged into the site, it's going to take you to a screen that looks like this. Right on over here, this little green button is going to say Start Enrollment. Mine says Finish Enrollment because I've already clicked in it. But you can go out and go back in, and then it will say Finish Enrollment. You're going to click on this. It's going to take you screen by screen through everything you need to do. Start Enrollment. Over here is going to confirm your personal information. Next page is your address. You're going to enter it. You can edit your address just by clicking on it, and then save and continue to take you to the next page. Going to get to your dependent information. If you need to add a dependent, you just go right over here, add a dependent, plug in all of their information. You will need to have a dependent social security number in order to enroll them. If everything looks good, it's going to be save and continue. Next page is going to be the medical plan. It's going to give you a little information. On the right-hand side are helpful resources. You can click on it. Here's the link to locate participating providers. You can find them over here. You also have the SBC located. So if you have any questions about the plan and in more details, right over there. Keep scrolling down. If you click on compare, it's going to give you the price for each of the plans as well as the benefits for each of the plans side by side next to one another. If you do not want the coverage, you're going to click on the blue do not want this benefit, and please choose the reason why. All the way at the end is the enrollment summary. My enrollment is not complete because I chose the HMO medical plan and I didn't choose a doctor. I chose the dental HMO and I did not choose a dentist. And I chose, I didn't choose a beneficiary for my life insurance, and therefore you'll see those little orange dashes next to that section as it's highlighted in orange. Once that information has been completed, you'll see a green little check and there will be a sign to complete on my enrollment summary. Again, I need all individuals to sign on and either elect or decline their coverage by Monday, October 5th at 5 p.m. If you have any questions at all, please do not hesitate to reach out. The last page of your Benefits at a Glance has all of the contact information that you could possibly need. You have the telephone number for your medical provider, which is Florida Blue, as well as their website, dental, vision, life, critical illness, guardian, and their contact information is there. Information on the college tuition plan, the employee assistance plan, the HSA, and then both myself, Colleen Hernandez, and Debbie Rito in my office. You have both our phone numbers and our email addresses. If you need anything at all, please do not hesitate to reach out. I thank you very much, and I hope you all have a great day.